Group 16 Disability Assessment Video. This is patient X, who is using a wheelchair and visiting their local clinic. They enter the clinic via the wheelchair accessible ramp. As you can see, they are navigating the parking lot of the clinic easily before reaching the front desk for assistance. The patient is being assisted by a relative to go up the ramps, as they are steep and they are unable to go up the ramps by themselves. The clinic has ramps throughout for patients who use wheelchairs, making it easily accessible. When the patient reaches the front desk, they are welcomed and asked to sanitize their hands to help prevent the spread of infection. After sanitizing, the patient receives a mask and a sticker to identify them during their visit. The patient is then instructed to proceed to collect their file. The patient is now collecting their file from the administration counter. The space is wide enough for the wheelchair to move freely, and the counter is at a wheelchair-friendly height, allowing for communication between the patient and the administrator. Disclaimer: consent was obtained from all the patients and staff appearing in the video, as it was that day a busy day. After the file is collected, the patient proceeds to the consultation rooms. As mentioned before, there are ramps located throughout the clinic. Therefore, the patient needed assistance going up and down the ramps, and their wheelchair was not in good condition. Before proceeding to consult with the healthcare professional, the patient must start at the vital signs station to have their vital signs taken. As you can see, the sister is taking the patient's blood pressure and other vital signs such as the heart rate, respiratory rate, and temperature. The vital signs were noted in the patient's file, and the file was returned to the patient so that they could proceed to the consultation room. There is enough space in the rooms and vital signs station for the wheelchair to move and fit comfortably, and for the staff to move around freely. In the consultation room, the patient is greeted by the healthcare professional and hands the file to them. The healthcare provider reviews all the patient's concerns, performs the necessary assessment, and determines the appropriate treatment for the patient. The prescribed medication is then dispensed to the patient. The healthcare professional explains how to take the medication, discusses any important precautions, and answers any question the patient may have before they leave the consultation room. Before leaving the clinic premises, the patient requests to use the toilet facilities. The patient is assisted by their relative to use the facility. The toilet is big enough for the wheelchair and the relative to fit, and it can be locked, allowing for privacy. The handrail assists the patient in transferring from the wheelchair to the toilet and back to the wheelchair. There is also a tap which is accessible, allowing the patient to wash their hands. After this, the patient was able to go home. A special thanks to all the staff members of the clinic for assisting us and allowing for a smooth process. Overall, the clinic showed positive features throughout the facility.